Hi, Tony again, and today I will discuss about another clinical skills that is arterial line insertion. First, as usual, I will discuss about a checklist of equipment. First, we need a sterile gloves always, and next we also need a sterile strip. That is sterile strip to create a sterile field. We also have a 2% of here we go. We also need a 2% of chlorhexidine swab or lollipop for the skin preparation. And next, we need a 1% lidocaine with syringe and needle to numb the skin. We also need a syringe, and the most important thing here, that is the arterial line catheter here. And we also need a guide wire and arterial line insertion needle. The needle to access the artery right there. And we need a gauze swabs and sterile dressing to cover and secure the insertion site. And we need to repair the waste disposal bag and or a sharps container for a safe disposal of needles. Right, so I will talk a little bit about the hand position. For radial artery line insertion, the goal is to expose and stabilize the radial artery by extending and slightly the wrist. And position instructions include patient's arm should be rest comfortably on the form of flat surface. For example, we need the arm board or a bed. And for the palm, it should face upward and the wrist should be extended to approximately 30 to 45 degrees. This can be get by placing a roll towel or a small support under the wrist. And you know what, the extension brings the radial artery closer to the skin surface, making it easier to palpate and cannulate. The fingers should be relaxed, not clenched, and the elbow should be slightly flexed or fully extended, depending on operator comfort. So now I will go straight to the procedure. I now going to demonstrate the arterial line insertion. First, after you clean your hands and put your sterile gloves on, and you need to palpate bilaterally the patient's radial arteries and decide which side you happier with. And to start, position the patient with their wrist extended as shown to give you easier access to the radial artery. We will clean the site using the 2% of chlorhexidine lollipop and then cover the site with the sterile drape. That's it, the lollipop. And cover the site with the sterile drape. The next step will be anesthetize the site with 1% of lidocaine. Palpating the artery again, insert a needle. Warning the patient there will be a sharp scratch and raise the blood with about half a milliliter or 1% of lidocaine. Following this, massage the site in order to disperse it around the tissues and give yourself easier access to the artery. While the lidocaine is working, you can prepare your equipment. Here we have the line itself with the guide wire inside of it. If you remove the guide wire, it will be ready for the procedure. We're now ready to insert the needle. Prepare the radial pose, and similar to how you would in the arterial blood gas, but at a more shallow angle. Introduce the needle until you see the blood spurting. Following this, thread the guide wire down the needle. It should pass easily into the artery. Apply the pressure with gauze, remove the needle, leaving the guide wire in situ, then thread the line over the guide wire, which can be tricky to do. The important thing is that in this stage is to ensure that there is plenty of guide wire visible from the end of the line. You do not want to lose this in the patient. Following that, insert the line over the guide wire, again keeping hold of it and ensuring that it's not lost in the patient. Remove the guide wire, then connect the transducer you set up earlier and apply the stereo stressing. So that's all done.